Hi everyone, I'm Moitri Sinha, co-founder and CEO of citiesRISE. We are so excited for this opportunity and the partnership with Morgan Stanley on the Gathering Spaces innovation. In our rapidly changing world, we need collaborative action between youth, communities, and professionals to turn the tide on mental health and make it humanity's greatest asset. Let's hear directly from Sika, a youth leader in mental health from Seattle, Washington, with whom we have been working in the field since 2019, about the importance of this work and the paradigm shift that the world needs.
Thank you. What brought me into the field of mental health was when I was 8 years old, my older brother of 4 years attempted suicide. What was difficult wasn't his attempt alone, rather, it was the fact that I had no support afterwards. Whether it be in his clinical sessions, at school, or even at home, no one cared to hear my voice. But that changed after I found out about citiesRISE when I was 16 and I won their Youth Challenge Award. They provided me with the space and the tools and a microphone to create productive change for my story and my brother's story. What was important is that now, even at 19, I'm still working so closely with citiesRISE to make global productive change. I'm sharing the stories of many people, many young youth leaders across the world. And it's amazing to see this kind of work happen.
Thank you so much, Seika. Hi, everyone. My name is Kevin Hale, and I'm a program manager with citiesRISE based in Seattle, Washington. Seika's story is a powerful reminder that mental health is a critical issue of our time, and that we have to reimagine how mental health supports are developed and delivered for young people. The data that's plotted on the blue and yellow graph confirms what young leaders like Seika have been telling us for years, that the traditional mental health care system alone is not enough to meet the growing needs of youth. As the graph on the slide indicates, the rates of social and emotional distress for youth have been steadily increasing for the past decade, and we know that the global pandemic has only exacerbated this problem. And even though more young people are accessing traditional mental health care every year, this access is not universal and it's not sufficient. Many critical populations of young people are being left behind. For example, BIPOC and LGBTQIA+ youth are disproportionately underserved and excluded from accessing services within the system. At citiesRISE, we're committed to shifting this narrative because we know that mental health is a critical asset for individuals and communities to thrive.
Because of the need for paradigm shift, we created citiesRISE in 2017 as a collaborative platform for action, bringing together youth, social entrepreneurs, people with lived experience, mental health experts, and system leaders from around the world to drive transformation in youth mental health. We are currently working in 5 diverse cities, which are serving as innovation hubs in 4 countries. Our accelerator and learning platform helps connect innovations across cultures and contexts. And we are building a movement of mental health friendly cities at the cutting edge of transforming youth mental health, one that reaches all youth and help them move from surviving to thriving in their community. In order to achieve both speed and scale, our local global structure enables us to bring the best of innovations, evidence, and expertise from around the world to come behind the leadership of youth and local communities in the US and collaboratively take on the deeply rooted challenges in the US system. The Gathering Spaces innovation is an example of what can come from this network, and what was originally developed in Nairobi is now being adapted in the US.
The Gathering Space model is an innovative approach for bringing mental health support directly to young people. It integrates evidence-based practices into community settings where young people are already actively engaged and connected. Our model will promote mental health for young people by using peer support, storytelling, art, mental health literacy, and technology-based interventions. These core ingredients were identified by young leaders from around the world. We asked them how they and their peers were most comfortable to engage with mental health interventions, and then we took their feedback and incorporated it into the design of the model. By meeting youth where they are in the community and delivering interventions using youth-informed ingredients, our model will remove the barriers that many marginalized young people face to accessing mental health care. Additionally, it will enhance the capacities of community settings to better support the mental health of young people that they're already serving. citiesRISE has spent the past 4 years identifying and building relationships with the types of community providers where youth actively seek out connection. And it's through this network that our model has immediate scaling potential. Our partnership network is very diverse, both in the populations that they serve and the activities that they offer. For example, our network includes drop-in centers for LGBTQIA+ youth, Native American cultural hubs that use theater arts to celebrate Indigenous identity, and mentorship programs that coach BIPOC youth on social and academic development. These are not traditional mental health providers, and that's okay. Our team will work with partners to effectively integrate the model into their programming. This process will include a phase of trainings for youth leaders and adult allies, a phase of adaptive implementation, and a phase of shared learning amongst the network. Mental health is a dynamic issue, and it requires dynamic solutions that touch on multiple domains of the human experience. For this reason, we believe that the gathering space model will bring unique value into the mental health ecosystem. From our initial implementation in Nairobi, we learned that the model has cross-cutting impact, that it promotes well-being across the individual, interpersonal, and environmental domains. Over the next year, our gathering space model will be integrated into 6 community settings in the US, 3 in Seattle and 3 in Sacramento, and it will be accessed by over 3,000 youth. As we scale the model, we're really excited to build out the evidence base for its effectiveness in the US, and we anticipate that the model will demonstrate impact across each of these 3 domains, promoting well-being at the individual, interpersonal, and environmental levels.
While there are many innovations that are addressing various aspects of gathering spaces, the unique value proposition of this innovation is that it brings structured support to the convening power and trust of existing community systems that makes it highly scalable. For an effort like this, we need multiple disciplines to come together. Our team is diverse in our identity and combines mental health, lived experience, youth development, human flourishing, arts, storytelling, and research expertise with the business and policy acumen needed to influence both practice and policy. Importantly, we are committed to youth-centered transformation, and young people are core members of our team. In 2022, the pilots in Sacramento and Seattle will lay a foundation for city-based innovation hubs to anchor scaling. Through this approach, we can directly impact a significant number of young people while building out the local innovation and national expansion infrastructure required to continuously learn and improve the model. With the right investment, we can support over 45,000 youth by 2024, with the growth rate increasing exponentially each year.
Imagine a world where mental health is our greatest asset and not our greatest burden. And we can do this, but it's time to rise. It's time to put youth in spaces that affect them.
It's time to join forces across sectors, generations, and cultures to bring innovations like gathering spaces into more communities.
It's time to invest in bold ideas and practical action. We are calling on philanthropists, corporates, practitioners, community leaders, and policymakers to join us, along with young people themselves, to bring critical innovations like gathering spaces to cities across the US. Together, we can turn the tide on the US mental health crisis.